when you finally decide to get up from your studies or work or gaming or whatever you're doing, sitting for a long time, that short muscle is then stretched out to a longer length, and it's a new sensation. And typically people feel tightness when that happens. How's it going, everybody? It's Dr. Nick here at Chiropractic, your Baltimore area chiropractor. We're here today with
Taylor
and
Bella.
Oh, cool. Taylor is a student where?
at Towson
What year?
University. Oh,
How do you not
It's
know
my
your
last year.
It's her last year. So school's ramping up. She's doing a lot more sitting. Hips are feeling tight, so we're going to help her out with a little psoas, soft tissue work. So go ahead and lean all the way in. All right. You ready?
yes.
Cool.
Yeah.
So the psoas, deep hip flexor. Go ahead. Sits. Oh, that's a good one. Starts from their spine, connects along the anterior portions of the TPs, and runs deep through the front of your hip here and attaches down low. So primary action of this muscle obviously is hip flexion. So if you do a lot of sitting, that's a lot of time that muscle is in a shortened state. Go ahead. And then when you finally decide to get up from your studies or work or gaming or whatever you're doing, sitting for a long time, that short muscle is then stretched out to a longer length, and it's a new sensation. And typically people feel tightness when that happens. Go ahead. So this is just one way that we help address this kind of issue. Good. Let's do one more. Taylor's also super active. She works out, what, almost every day? No?
Maybe like 3-4 times a week.
Okay. Better than most. So that's another way of helping address this, is just being active. Good. Guys, if you have any questions about psoas, tightness, tension, anything else we do in this office to help address sort of that anterior hip tightness, leave a comment down below. Otherwise, we'll see you in the next one.